Hey, everybody. Welcome back to a very, very special Heart and Soul podcast episode. This one it's just special. I don't know how else to say it. We are so very fortunate to have one of Monique's care team, Dr. Alyesia Lukach, with us here today. From Kentucky, I believe. And we're so excited to have her speaking with us about the work that she has been doing as part of Monique's care team on her breast cancer journey. In our past two episodes, Monique shared her story, and this is the next phase of sharing with the world her journey and all of the resources and information that she has found along the way that she really wants to share, and I want to share with our listeners and others. So thank you for joining us here today. This is our first remote guest podcast. So thank you to our producer, Asher, for helping us make this happen. We feel so fortunate to be able to connect from a distance. So welcome. And thank you, Monique, for being vulnerable and sharing, again, this really important part of your story.
Thank you for that, Mariah. Yes, as if you've been listening along, it's been an interesting journey for me, and Mariah has been walking alongside with me on this journey, and I have been very fortunate to have amazing people put in my path or on my path. But I just want to back up a little bit before we talk to Dr. Lukach about how we found each other.
Welcome to Heart and Soul, the podcast where we empower and inspire women to lead their best lives, harnessing the power of their hearts and souls. We are Mariah
and Monique,
your hosts and guides on this journey of self-discovery and personal growth.
In each episode, we will dive deep into topics that matter most to you, from self-love and confidence to career development, relationships, and everything in between. We believe that every woman has a unique strength and inner wisdom waiting to be unleashed.
Join us as we cover insightful heart and soul-centered topics and interview incredible women who've overcome challenges, chased their dreams, and found their true purpose. Through all of this, you will discover practical tips, strategies, and real-life stories to help you navigate life's twists and turns.
For whatever season of life you're in, this podcast is your safe space to explore, learn, grow, and possibly even laugh and cry with us. So grab your headphones, maybe your favorite drink, and we'll embark on this transformative journey together.
With heart, I'm Mariah.
And with soul, I'm Monique.
As I had mentioned previously, I was raised, instead of going to a doctor when you had ailments, you would take like vitamins. And so when I went to the surgeon and they were telling me the things that they wanted to do, I was like, hell no. But I didn't know what else to do, right? Some of the things I could get behind, like actually removing the tumor, but some of the things like extensive and aggressive chemotherapy and hormone replacement therapy, I had a really hard time wrapping my head around. And, since then have talked numerous times to other doctors as well. But my mom was the one who connected Dr. Lukach and I. And when I scheduled a meeting, she made herself available to me right away. And here's me coming out of, a really hard conversation with a surgeon of like, you have to do all this stuff. And I'm like, what? To, I can't do this stuff, to then finding her, setting up an appointment, really getting in really quickly because she makes herself available for, extreme cases right away. And I think I scheduled an hour and we spent almost 3 hours talking because she's so generous and kind with her time. And when I was done with that, I felt so seen, so heard, and also so relieved that there were other ways to support myself, through this diagnosis. And so I really want to just turn it over to you, Dr. Lukach, because I want you to talk about your training, the things that you can help people with, because I cannot be the only one out there who gets this diagnosis and just says, well, not that. So I guess I don't know what else to do. Right. So yes, thank you so much for joining us today. And please, you have the floor.
Thank you so much for the kind words. It's such a privilege to be able to work with cancer patients. And as much as cancer is my focus, I've been seeing patients, from all kinds of walks of life, anyone from children to, elderly to any type of ailments, really, just because the naturopathic world does give a different perspective than, as you said yourself, from conventional or allopathic medicine. So, meeting your mom, and then she reached out about me connecting with you. So typically with any cancer patient, I typically block out about 2 hours of time just because I know, we hope to get things done in an hour, but everyone comes from, a different story, a different background. So sometimes some patients need a little bit more support, and I think that's what's a big piece is what's lacking in the conventional oncology world as well, is just people being heard and having all their questions answered and feeling like they have the proper support instead of kind of just being like, here, this is your protocol. Good luck, and
That's exactly how I felt. I felt like I was just like in the production line.
Yep.
When this happens, this is what we do. So this is what we're doing for you. And I ask questions and they're like, this is the white glove of care. This is what you must do. And it's intimidating.
It is very much so. Yep. And it's a protocol, and it's when you're in a hospital system, it's that much harder to deviate from a protocol. And that's why we kind of have a different approach to supporting cancer patients and looking at every single person as an individual. Because again, everyone has different labs, has different everything that kind of led up to their diagnosis. And I mean, no one's life is the same. No one person is the same. So why do we approach all of them the same? So it's a little bit, that's what kind of drove me crazy being, seeing and working in the hospital and seeing this type of patient care. And then that's kind of why I ventured off into naturopathic medicine and wanting to learn more and knowing that there has to be more options and better options and kind of being the doctor for my patients that I would want for myself.
I love that.
I think that's the biggest kind of difference in oncology. Was there anything, a specific question you had wanted me to address, or was that covering it?
No, that's perfect.
Okay.
Just that, there are other options for caring for people who have a cancer diagnosis. But your training in naturopath oncology, can you go a little bit and tell us a little bit about how you landed into medicine and your path so that people can understand how people are trained that have kind of a similar path to helping people as you?
So in terms of naturopathic oncology, the approach that I go by is via the metabolic approach to cancer as taught by Dr. Nasha Winters. So she's a pretty big name, in the naturopathic oncology world. And she herself had stage 4 cancer, terminal cancer, diagnosed at 19. And she was diagnosed at 19 and she's, I think, 30 plus years past her diagnosis now. So she's not only lived with it and survived it, but now she's thriving, and she became a naturopathic doctor. And now her life is just doing research and teaching and kind of changing the approach to cancer in general. But essentially I took her program, and I think, if anyone wants to learn more, because her program, there's, a physician, practitioner side, and then there's also kind of a patient advocate side. So essentially anyone, if they want to learn more, even cancer patients themselves, sometimes they will take like the advocate program just so they learn and, like the nitty gritty details of everything, if that's something that they're interested in. So that's essentially where my oncology training came from. And my approach into naturopathic medicine kind of started when my own family members started having issues, mainly my dad, having, some heart problems and things like that coming up. And this was back when I was still in college, still trying to figure out what to do with my life. Whether it was, do I become a PA or a nurse practitioner or, an osteopathic doctor or a medical doctor. Everything was kind of up in the air, as, it often is when you're in college. And then once I finished college, I worked in the OR as an anesthesia tech. So I worked in the ER as a scribe while I was in college, and then I switched to anesthesia tech. So I really saw kind of the ins and outs of the hospital overall. I kind of worked on every floor a little bit, and I kind of just saw just the whole medical system as a whole. And then essentially what kind of gave me that last push into naturopathic medicine was when my dad kind of started having some issues and he wasn't getting his answers. He was getting really frustrated with the system, and he was at the point of just giving up because of the lack of answers and lack of support. So at that point, I was like, okay, well, I kind of have to do this other approach because I just didn't see another option for myself if I wanted to help myself, help my loved ones. And at that point, it was, helping my dad. So essentially, that was kind of the catalyst into going into naturopathic med school. And, I did 4 years of that. And then it's definitely a different approach from conventional medical school, just because it's still the initial training is pretty much the same. But as we get into, how to support healing within the body and help patients and everything, the approach is just different. We use things like supplements, herbs, nutrition. I have my master's in nutrition. And then getting my doctorate in naturopathic medicine. You have to kind of choose what you want to work with, what type of modalities, just because there are so many natural and holistic modalities out there. And you kind of just have to see what you vibe with and what you prefer to use and how you go about it. And on the clinical training is really the biggest piece there, and figuring out what type of doctor and practitioner you want to be, whether you want to join a clinic or open your own office or join a hospital or do research, whatever it is, there's a lot of options. The oncology cancer world kind of also came to me randomly. It was just, I would have people just reaching out, and I would tell them, I don't really know. I'm not, specifically trained in oncology. And they would be like, well, just give me something, I need just anything really, whatever support you can come up with, just give me something. At that point, I was like, okay, well, I kind of need to go a little further and actually figure out how to approach this correctly. And then that's where I met, Dr. Winters, which I'm very, very grateful for. She taught me so much and continues to. So I would say she's, the biggest mentor, more than anyone else in my journey so far. And now it's, working with patients, now it's my patients that are also my teachers, and who I learn from the most, as we're getting into, just clinically, seeing patients and day in and day out, speaking and making these connections and building relationships with my patients, and, finding the time to do so, because essentially that can be difficult, especially in the oncology world. So.
Yes. And I will say, I'm in Minnesota and you're in Kentucky, and you were able to help me remotely.
Thank God for technology.
I know, it's kind of amazing. And also, you were able to help guide me towards a path that felt more holistic. Mm-hmm. And in Dr. Winters' book, they talk about the terrain, right?
Yes.
How we are so much more than just I was talking earlier about how you feel like you're just kind of plugged in. Once you have this diagnosis, they just like put you through, and this is what they do. When we get this diagnosis, this is what we do. Yeah. But you're so much more than that. Like you said, every single person is so different. So in her book, they talk about the terrain. So there's so much more of a deeper dive into mm-hmm. just to finding the why, right?
Yep.
Yeah.
Yeah, so that's where the terrain of each person essentially is different. And that's where all of Dr. Winters' training, she always talks about, looking at the specific person and kind of not forgetting or ignoring the cancer diagnosis, but for some time it is good to even kind of ignore that diagnosis and because as soon as you get diagnosed, it's kind of the zeroing in on the cancer cells, a tumor, the type of tumor, and you get kind of this bombardment of information,
Yes.
which is good in its own way, but you get plenty of that as a patient, from the standard oncology, conventional approach. So that's why when we kind of switch the perspective and the discussion to looking at more of, you as a person, what types of trauma or what life path did you come from? What does your terrain look like? And that terrain essentially comes from, what your labs are like and all the pieces that we can kind of put together based on your labs, based on your symptoms, based on how you're feeling. And we kind of have to look at every single little piece, the mental, emotional piece, the physical, you're looking at your diet, looking at your nutrition, looking at your stress levels. How do you cope with stress? There's so many little pieces to every single individual, and they're all very different. So that's kind of where, when Dr. Winters talks about the terrain, which she talks in great length about it in her book, The Metabolic Approach to Cancer.
Yeah.
I just love this is already so eye-opening to me, and I understand so well how I think I saw Monique not long after she got off the phone with you the first time, and she was like, I finally met someone who sees me and hears me. And like you're talking, for the 10 minutes that I've been listening here, I'm like, no, I understand. I get it, because it's that whole person approach that, we are made up of all of our collected experiences of generations, not just the one tumor. And so I thank you for sharing that, and for Monique bringing this, modality to share with our guests, because I think that why not have lots of ways to work on your health? Why not have, this approach as well as, the conventional approaches that are recommended too? Why not?
Exactly. Yeah. And that's, essentially where we're coming from. It's like, why not do all you can to support the body? And when it's going through such a difficult time, it's stressful regardless of how strong you are or how many times you've experienced, dealing with any type of sickness. It's always a stressful time, and it's always scary. So, some people, they prefer to just have, a protocol, and they prefer not to think too much about it, I guess.
Yeah.
But then there's this, in general, I feel like most people want to know more about their health, and they want to learn, how to feel better and be healthier, and essentially how to support their body through any type of, even if they do get just the standard conventional treatment, or if they, choose to deviate and find a different approach.
Yeah.
And so much. Oh, go ahead.
We had talked to Christina Kintop, a chiropractor, on a previous back episode, and it was all about that as well, like supporting the body so that the body can do what it knows to do. And so Mariah and I had actually already been on this kind of journey before I got my diagnosis and had the labs, and you were able to work off some of the labs. But I'm sorry, Mariah, go ahead and say what you're going to say.
Well, all of this, again, just leads me to totally understand in hearing you talk, even for a few moments, why Monique was so immediately taken with adding this approach to her care with her cancer diagnosis. So I'm really interested, as somebody who's not gone through this and has typically followed a pretty traditional path to medicine, what are the types of things that you recommend to your patients that are going through a cancer diagnosis, and how has your life changed, Monique? Question to you, like what did I know you had to do a lot of things quickly and change your lifestyle quite a bit. What has that been like? I think there's just so much to share here about what the different ways this can look.
Yeah, I think I'll just take this first because, and then I would love for you to talk about some of the other ways to help support the body as it goes through treatment and has a cancer diagnosis. But to Mariah's point, there were a lot of things I didn't want to do from regular allopathic care or treatment of a cancer diagnosis because I felt it was very extreme. And in my case, I was very fortunate with very early detection and catching it at a very small, the tumor was really small. But I didn't know that, but I just had a feeling. And so Dr. Lukach gave me a lot of homework to do. And I integrated quite a bit of it right away because I was just like, I don't want to do that, so I'm going to do this. And I might still do that. I might still do some of the things they're saying, but I know that a lot of this is totally doable. But I will say, just before you start, the hardest thing for me was the ketosis diet, keto diet. And that's because I am a recovering sugarholic. And I say recovering because I haven't had sugar in so long. I don't know, it's been like 3 months now. And the one thing I just want to say before I have you talk about it, because it's a really big piece, is what we eat is a choice. That stuck with me. Like, okay, I have choices here. I can choose to make different choices. And also, I started seeing sugar in my diet as poison. And that's how I've been able to stay on this diet for 3 months. So anyways, I just want to interject and put that in there before you went on. But please, to Mariah's point, tell us some of the things that you, and please feel free to use my case, that you would recommend people with a cancer diagnosis do to support their care.
So I think it's good to focus on breast cancer specifically, just because every type of cancer, there's kind of a different reason why it happens. There's a different approach to it. There's different ways to support the body. But kind of across the board with the majority of cancers, when we look at a person's metabolic health, so metabolic health just translates to mitochondrial health. And mitochondria are, the little organelles within our cells that produce energy. And there's been a big shift, even I feel with a lot of conventional oncologists, but the oncology world in general, it's kind of like a shift from thinking that, cancer is kind of just bad luck. It's, it's your DNA, it's your genes. And it's kind of like, it sucks for you because your genetics aren't that great. And now there's that shift from thinking that cancer just kind of happens out of nowhere to looking at more of what is your mitochondrial, your metabolic health look like that kind of predisposes you to not just cancer, but any form of chronic disease, which the metabolic piece is really kind of this common denominator that we do see with heart disease, with diabetes, with cancer, with any type of chronic disease, because cancer doesn't just happen. It takes years and years to proliferate and to kind of brew within the body. So, and it's, within the body, it's not just within the breast cells or within, a specific organ. It's the whole body that really causes this manifestation of this type of disease. So, when we're looking at breast cancer specifically, there is a huge metabolic piece to breast cancer. There's even some, in the naturopathic oncology world that say, like triple negative breast cancer is specifically diabetes of the boobs or the diabetes of the breasts. And there's
Which
even
is
things,
exactly what I have, right? Estrogen, progesterone, HER2. Is that what you're saying?
I believe, yeah. Well, no, you don't have triple negative. You have the ER, PR
Sorry.
positive, right?
Yes.
And then HER2 positive. And the HER2 protein, that piece was the one that was the most kind of concerning and, kind of induced the most amount of fear. And that's why they're kind of recommending a more aggressive approach.
Yes.
But like I mentioned, to you already about how having the issue within HER2 issues in general are related to lack of exercise and a lot of stress. And then if you say you go through the treatment, the recommended conventional treatment for anyone dealing with the HER2 positive breast cancer, you have to, in order to even kind of gauge the side effects and try to minimize those side effects, you still have to incorporate exercise because it's all about heart health. Because typically, with the medication that is used, it's cardiotoxic. So it's like, regardless whether you choose to go through conventional treatment or you don't, you need to exercise, you need to improve oxygenation within the body, and you have to manage your stress. And
we're working on it.
Yeah.
And that's a big piece, with any type of cancer, really. But the common things that we see within our breast cancer patients is the whole metabolic piece. And again, that translates to blood sugar dysregulation, high, insulin levels, high things like hemoglobin A1C, which is the diabetic marker. So, and then low vitamin D. So these are all aspects of the terrain. So this is when we're looking at labs, what we're assessing is, what is causing the proliferation of this cancer within this specific patient. Because everyone's labs are very different. Everyone has somewhat of a different approach. But when we're looking, the common things within breast cancer is these metabolic pieces.
Yes. And so in the book, The Metabolic Approach, which I probably gotten halfway through, the keto diet is one of the ways to help manage that, specifically that insulin. So can you speak a little bit more? Because it's interesting, the more people I've told, they're like, why the heck are you doing keto? Because I was raised, vegan and vegetarian.
Yeah.
So it's been a stretch. I would like it for you to share or speak to it a little bit more.
So, I work with a lot of vegan, vegetarian patients, and I try to kind of shift away from the food discussion specifically because there's a lot of strong kind of beliefs and opinions behind it. And I'm like, that's fine, and it's more, let's shift the conversation to what is best for you, and if we're looking at things like high hemoglobin A1C, which is an average of 3 months of your blood sugar, and we're looking at high insulin levels, in order to improve that, there's a million studies I could show that, indicate that you need a lower glycemic diet to improve these markers. And the fastest way to improve these markers is going into ketosis. So, anyone dealing with cancer, they don't always have time on their side. So this is why going into ketosis, if you really want to target and, jump in head first and really do what needs to be done, going into ketosis and keto, essentially the keto diet is just the fastest, kind of easiest way, most sustainable way to get your body into ketosis. There's other ways of getting into ketosis, like fasting. There's a fasting mimicking diet. There's other diets you can implement, but, for sustainable, for anyone that's trying to live their life, not everyone can take time off of work and things like that. So the keto diet is most sustainable in that you can still, you don't have to be hungry. You don't have to necessarily fast. Intermittent fasting is kind of a better way of, or a faster way of putting you into ketosis. But in general, you can pretty much you can eat good food. You don't have to be super restrictive. Kind of depends on the person. Some people, they do feel it's restrictive, but in general, you can still eat a lot of great food and not be hungry all the time and still get into ketosis essentially ketosis, it just means that your body is in a fasting state. So generally speaking, as a society, we used to be in ketosis a lot more. And ketosis versus glycolysis just means the biochemical kind of physiological shift from when we're breaking down sugar, or carbohydrates for fuel versus breaking down fats for fuel or ketones. So that's the biggest kind of difference when we're talking about ketosis versus not being ketosis. And our metabolic flexibility, meaning our ability to get into ketosis, has just gone. Basically, it's almost gone in a lot of people. They're not able to get into ketosis at all, and that it requires them to kind of teach and train their body to essentially be able to get into ketosis, and that can take some time. Blood sugar stability, that can take weeks, months to kind of get to where you want to be. But again, doing something like the ketogenic diet is usually the fastest, most effective way to get there.
Yes. Thank you so much.
Of course.
And how has that been for you, Monique, going onto the keto diet? Because you started immediately. I mean, she took your advice and when Monique decides to do something, she's all in. So, and I know you had largely been vegan, vegetarian for a lot of your life. So I think it'd be interesting to share what that's been like for you.
Yeah, it was exceptionally difficult in the beginning because, as a 51-year-old who hasn't gone through a diet, right? And I had gone through diets, tons of diets, and the primary focus of a lot of diets is low fat. And here comes this lady saying, support your body through this cancer diagnosis by eating fat. And I'm like, what? And I'm like, I'm going to weigh 5 million pounds, but
and no sugar.
Yeah. And yes. And then there's the no sugar, which a recovering sugar addict maybe had a couple temper tantrums about. But probably after the first month, Mariah, you might even be able to attest to this. I don't think about it. I'm able to easily do it. There is some alcohol. I mean, because I am a normal person. I'm not saying I drink a ton, but maybe once a week I'd like to have a cocktail. There is some alcohol, gin, tequila, and vodka, and of course using it in moderation, right? And I didn't drink for the first month or so because I had the surgery and I wanted to be very strict so I could get it down pat. But after the first month, I do not crave sugar. I was very fortunate. There's a lot of people who get like the keto flu and it lasts a long time. I had it for a day. I had a severe migraine and it just like body aches and chills. And then I think I might have had like sort of a intestinal purge that happened. The MCT oil also helps with that as well, or it can facilitate some of that as well. But if I'm very regimented with it, I have dipped in and out of ketosis, just depending on, I guess, the nuances of my body. I don't know. I track it, with the urine sticks, and it's very important to me. And it is definitely something that is sustainable, but you have to make it a priority and remind yourself it's a choice. What you put in your mouth is a choice. We
you
seem
are
to
what
think
you eat. Is that what you're saying? You are what you eat,
seem to think,
and it's a choice.
We're victims of what we eat. It's like, I can't eat this. I can't. Why? I was raised not eating a lot of meats, and she challenged me. And so I have since eaten pork, hamburger, steak, pork chops. I'm not a red meat eater. I'm just doing it.
All the meats.
No, people have made these things for me. I couldn't tell you how to cook them. But, but I've needed to alter. And it's when they say to you, you have cancer, you're like, okay, what can I do?
What can I do?
Right. Yeah, well, your body and it goes to the whole nutrient density piece. Why is it that vegan maybe isn't the best option versus vegetarian? It's because you can just Google, a chronometer online and look at the nutrient density of the foods that you're eating. So the whole point of food is to get nutrients, right? And when you look at grains, when you look at cereals, kind of all of these foods that on the food pyramid, they're telling us we should eat a lot of, these foods are very, very low in nutrients. They're pretty much empty in nutrients compared to meats and fats, which are also meats and fats are essentially is what keeps your blood sugar stable versus the grains and the carbs and all of that. Not only is it nutrient dense, but if you have metabolic issues, it's just going to keep spiking your blood sugar, and your blood sugar is going to be going on a roller coaster.
And again, that's important because my understanding is cancer is so identified by this metabolic disturbance. And it's, I kind of, in my mind, this is how I equate the story. Cancer eats sugar. Don't feed sugar. Don't give it the food it needs, which is sugar. So don't eat the sugar, right? I mean, that's just my basic, the way I describe it.
And I mean, there is an argument with conventional oncology that cancer, is essentially smart, and it will kind of mutate and learn to get fuel sources from something else. But regardless of what the talk might be or the discussion might be, cancer, the easiest fuel for cancer is the sugar and the carbs, essentially. So why not make it harder for the cancer, even if it's still able to learn and mutate and grow and use certain growth factors to use, other fuel. We still, again, need to do all that we can to not only support the body, but, cut off the ammunition to the cancer.
Yes.
So the diet has been one part of your treatment and treating your body. What else are you recommending for Monique as she goes forward in this journey, and for anybody going through breast cancer?
So for Monique specifically, Monique, are you okay with me discussing the specifics?
Yes.
Okay. So we started with, looking at like very specific markers within her labs. So certain growth factors, like there's VEGF is a pretty common growth factor. And there's a lot of drugs that are being created these days to target specific growth factors. But the problem is that oftentimes these drugs come with kind of their double-edged sword, where they might, impact the pathway and blocking the pathway, but at the same time, they cause more kind of proliferation of autoimmunity within the body. They cause your metabolic health to go into the toilet, essentially. So it's like, is there a benefit or no? And also there are studies showing how being ketosis actually affects in terms of how it affects the cancer, is that it reduces the ability for cancer growth in terms of all of these pathways that everyone always talks about is, how the cancer grows, essentially. So what we did for Monique specifically is we found whatever's abnormal in her labs, and we're working on how to get those levels, at where we want them to be, because there's more of like a functional or optimal levels that we're looking for, and not just within range or, whatever the lab says is within range. We need in terms of metabolic health, we need optimal levels. So for, even hemoglobin A1C, some people might not be diabetic yet, but if they're not at that optimal range, we have to get them there, and it's not just one marker that we look at. We have to look at the culmination of all of these markers and put all of these puzzle pieces together, because people might look like they have normal blood sugar management, like their fasting glucose might look okay, their hemoglobin A1C might look okay, but then their insulin is sky high. And that sometimes points to, maybe they're going through more stress or something going on in the liver. So again, it's not, this is where I'm saying every single patient is different, and the approach for every single patient is very different.
Yeah. So I've been doing castor oil packs. I have been taking supplements to support where I have deficiencies.
I have a red light therapy for not only, my breast tissue that I use on my breast tissue, but I also use it on my knee because as you guys know, I tore my meniscus too, and I have to have surgery on that. And then also there's other alternative or non-traditional like things that you can do too. Like, I don't know, can we talk about mistletoe at all?
Mm-hmm.
Yes.
I think so.
Okay. So, yeah.
So with for Monique specifically, you were dealing with, at least from what I remember, you were on thyroid medication for a while.
Yes. Yes.
Yeah. And that's where, we wanted to get a little bit of a deeper dive into what's going on with the thyroid, as in testing for thyroid antibodies and not just giving, synthetic thyroid hormone and hoping for the best, because, as you could tell yourself, it doesn't necessarily heal anything. It kind of just keeps you in limbo, essentially.
Right.
So autoimmunity is something that we're also working with the low dose naltrexone for you.
Yes. That's been actually a game changer with my energy level.
Mm-hmm.
I mean, changing the diet, but I feel for the first time since I started having thyroid issues that there's like hope, if that makes sense.
Mm-hmm. Yep.
And it's amazing, actually.
And that's a medication?
No. Yeah. So naltrexone is, it's commonly used, in conventional medicine. But we do low dose naltrexone. So actually like super, super low dose, as in like 0.5 milligrams. And that's typically where we start someone at. And so autoimmunity is kind of this starting piece to a lot of cancer diagnoses down the road. So when we see early signs of autoimmunity, we want to address it. And again, address the terrain, address the whole body. Instead of just giving medications, to suppress the immune system, essentially shut off the alarms and kind of hope for the best.
Mm-hmm.
And low dose naltrexone, it's gotten much more popular, I would say, over the last few years. And it's basically just, the hope is to see things like thyroid antibodies come down, and it's a lot of it is for symptom management, and again to help the patient just feel better. And we kind of find for the low dose naltrexone, we find kind of a sweet spot between 0.5 milligrams and about 4.5. A lot of people do pretty good, like in the middle there. I'm pretty sure. I think Monique, you're somewhere in the middle.
Yeah. No. Yeah.
Yeah. So,
and I feel pretty good.
Yeah. So that's kind of finding an effective dose, and also a dose where you feel good, because it can disrupt sleep. It can kind of make you feel not yourself. And that's why we kind of go slowly. We always start slow and work our way up.
Okay. So then I'd like to just, with the time left too, touch basically on the mistletoe, which is something that I'm working.
Yep.
I will be starting soon. It's kind of one of the last things that I'll be using that I haven't started to support my body. And I had never heard of it before. A lot of people have never heard of it before. And when I was researching it, it's just interesting. If you could share a little bit about the origins or how it's used and, how it works.
So mistletoe is Viscum album. It's literally the mistletoe herb, than Christmas. And typically, at like a high dose, it is considered toxic to the body. But what we use is homeopathic preparations. So it's typically via an injection. There's also IV mistletoe, but typically, we start slow. Again, we kind of start low and slow, and the injection is usually kind of the best approach, just to see how someone responds and watch their labs and all of these. Mistletoe itself has been around for a while, and there is a great book on it by Dr. Winters as well, with Dr. Johnson, I believe, but it's, I can look it up real quick. And so basically, the whole approach to dealing with and figuring out how to use mistletoe there is a study in by Johns Hopkins right now where they're looking at using mistletoe as an adjunctive therapy,
Wow.
which is pretty huge,
That is huge. Yes.
Yeah, in America.
Huge.
So,
Yeah, right.
Yeah.
United States of America.
yes, this is somewhere in in Europe, which
Yeah.
in Europe it has been used as like a non-toxic chemo. So essentially, there is toxicity that is involved with mistletoe, but that's why it's this individualized approach to the patient where we figure out what do your labs look like. We figure out, because there's different types of mistletoe as well. So that specific type is, we have to kind of figure out what matches the patient the best. And so the book that I'm talking about is called Mistletoe and the Emerging Future of Integrative Oncology by Dr. Stephen Johnson and Dr. Nasha Winters. So it's a pretty new book. They came out with it just a couple of years ago, but that has a ton of information on mistletoe specifically. And typically the whole point of mistletoe is to stimulate the immune system without overstimulating it. And without suppressing it, because a lot of, biologics and a lot of immunotherapy drugs these days, they're used to just suppress the immune system, when a lot of cancer comes from a dysfunctional immune system or the immune system not working properly. Even there's other alternative treatments or supportive treatments like hyperthermia. And hyperthermia is essentially inducing fever in the body, which is a huge part of the immune system, and we have even children these days where at the first sign of a fever, we just give a fever reducer, when we really should be supporting the fever. In a generally healthy child, a fever is a good thing, and the fever is just a sign that the immune system is working properly. So when we have someone dealing with cancer, the hyperthermia treatments are also kind of used to stimulate the body and the immune system within the body. And basically, with the body being at a high temperature, pathogens can't survive, and cancer has a harder time surviving. So, and then the whole kind of approach with mistletoe is kind of stimulating the immune system without overstimulating it, and that's why we start with, one injection, maybe every other day, and we have to watch for an immune system response. So if the immune system response is a little bit too much, then we have to reduce the dose. So that's why it's different, again, for every patient. But essentially, mistletoe has been found to, not interact with any type of chemo. It can be supportive with chemo. It can be, great for support on its own. So it's kind of, regardless of what approach you choose, it's a good thing to kind of get on board. Even people that don't have cancer, you can still do the mistletoe just because it's non-toxic. So if there's any sort of chronic disease or autoimmunity or something where the immune system needs to be balanced, mistletoe can be a great option.
That's interesting. I didn't know that.
Mm-hmm. Wow. So Monique, you'll be starting these injections?
Yeah, I had my first. So Dr. Lukach doesn't administer that. She referred me to another practitioner who supports that. And I had my first, assessment. And I'll be starting it within the next week or two. I just need to get some labs done prior to it. I felt, and we had talked about doing high doses of IV vitamin C, but my schedule right now doesn't support that. But that's another thing, just to help that immune system so it can fight off the things fight off the cancer, right? The cancer cells.
Well, high dose IV vitamin C is also, so people think, vitamin C, it's just a vitamin, right? So they think there's no toxicity associated with it. But when you do high doses of IV vitamin C, like we do for certain cancers, it is technically toxic and oxidative at that point. Chemo is also considered oxidative and toxic. So you have to be careful. People sometimes will just go and get high dose IV vitamin C without checking certain markers. Like, you have to check your G6PD levels. You have to make sure your insulin, you have to, make sure things are not higher than they need to be in terms of metabolic health. So it's not something you just go and get a vitamin. The low dose vitamin C, which is like the supplements you may take, or even like a lower dose IV vitamin C, that is considered antioxidative. So, it's kind of like why you might take some vitamin C if you're sick. It's to get that antioxidant piece. But when you do the high dose IV vitamin C, it becomes pro-oxidant. So it's actually, it can, it has the potential to be toxic to the body. People with any kidney issues cannot get high dose IV vitamin C. So it's not something to take lightly, but it is also a great adjunctive option for certain cancer patients. And some people, that's all that they'll do. It just really depends. Again, very individualized and very specific to what type of cancer you have as well.
Which, if the bottom line of the story is, if you want an individualized approach, this would be a way for you to get that. If you just want to do what allopathic care says, it's fine. You are entitled to it. But I am the sort of person who is curious, who wants to know more, who doesn't necessarily just buy into what the system sells me. So that's why when I found Dr. Lukach, I was just like, I feel so seen.
Yeah.
Mariah, I'm curious, you being such an outsider, what are your thoughts about all of this? You don't have a cancer diagnosis, and also this is not necessarily your world. Do you have any comments or questions?
Well, I feel like this conversation really makes it all make a lot of sense to me as to why you immediately responded to adopting a lot of these protocols or these modalities. And I mean, it really, to me, is like a no-brainer. Why not? Like, why not try everything? Like,
right.
I think, when you are in your shoes and you have this diagnosis, I think people freeze. They freeze and they just want someone to tell them what to do, exactly what to do. They're so flooded with fear and anxiety and all of the normal feelings and mortality, that they're faced with. And so it can be, you see people they just take, they walk the path and they don't look outside of what other options might be. And again, like you said, Dr. Lukach, like, the hospital system has requirements to just get people on the right path, for productivity purposes. So I think this is a really important part of your story, Monique, because it opens up my eyes and anybody who's listening or watching eyes to other things that could be done that are lifestyle and diet changes that you have control over, that are not necessarily that can be part of your everyday life and certainly couldn't hurt. Like, why not? And I actually have another friend who, when I think back on this, was many years ago, she had breast cancer, but she also took a very aggressive approach to not only the cancer treatment from an allopathic point of view or protocol, but also from a nutrition. I remember that was a huge thing in meeting certain nutrition markers. So I mean, I think you're onto something here, Dr. Lukach and Monique, and I would be all in on all of this too. Heaven forbid I ever need to. But I think that these are also really important things. I'm thinking, like, to start on now before you get the diagnosis. Like you said, like, these are all things that, like, you don't have to wait to start taking better care of yourself through your nutrition and your nutrients. And it aligns with our previous conversation with Dr. Kintop about, women and their bodies and how we, we're complicated, but we're also under-researched and under-supported in the complexity of what we really need to to take care of our metabolic system. So, just building upon that. And I think that I'm happy to be able to be sharing this and saying, like, this is something we have a choice about. We have a choice to think about what we put in our mouths and how we support our bodies through any disease. So thank you for sharing your story, Monique, to bring this to the forefront. And thank you, Dr. Lukach, for practicing this and helping each individual patient that you work with to figure out their terrain. I love that way of looking at it.
Yeah, I appreciate it. It's definitely a lot of, I would say it's a lot of time and effort, but at the same time, it's very rewarding, and it's really beautiful just to even see how people change once you just. It's not even telling them exactly what to do. It's just letting them come to their own conclusions of what to do and what type of decisions to make, because there's not one perfect or right or correct decision.
No.
And everyone's path might be a little bit different, but just knowing that they have other options, other tools available, makes a huge difference. And, it makes them feel less like they're just drowning in the information and not knowing where to go. And it's more, even having a relationship with my patients, just talking to them and addressing even the simplest questions, and just going from there and having like this snapshot of their labs and being like, here, look at what this marker is doing, and let's implement some of these changes and let's see this marker change. And this is things that they see in real time. Not only do they feel better, but they're seeing their terrain changing. And, and that's a huge motivation to keep going and to even stick to, a good lifestyle once they're past their diagnosis. Because a lot of times when people go to, specific cancer centers or something, or maybe they'll go to a different country and get certain treatments, and they might be free of cancer for a while. But then when they come home, you have to really make sure that they have a sustainable way of eating and a sustainable lifestyle, because otherwise they're just going to revert back to essentially what made them sick.
It's going to come back.
Yes, exactly. And that's kind of a big piece that a lot of people kind of either miss or forget about. I don't know, but we see that a lot as well.
Wow. Well, I feel like, Monique, your energy shifted immediately when you met Dr. Lukach, and the way that you took control over your own care and the decisions that you were making. It was like you came out of a fog, and that fog has gotten you through that coming out of that fog has gotten you through so many parts of your treatment and to the other side of living life now, in a way that's just good. Like, you look great. I'm this girl, she's on fire right now. So
he's in control.
Working.
He's in control
She's
now.
in control.
Yeah, that's a very good point. I do feel like my healthcare, my choices, they're in my hands. I didn't just hand over my power to people who maybe make more money or have more education in certain aspects. So I feel really, it was empowering to go through this whole process, while albeit very scary. So, well, I know we need to wrap up because we could talk forever.
We can.
I could pick your brain forever. As you know, I've had multiple conversations with you, and you're so patient with me. So I so appreciate it. But we don't want to go on too long. I just want to say, we will put your clinic's information in our show notes. So if anyone out there, and to her point that she made before, you don't have to have a cancer diagnosis to work with her. She sees my mom, who does not have a cancer diagnosis, for just naturopathic, not just, but naturopathic care, without the oncology piece too. So if you're looking for a naturopath, and I am in Minnesota, she's in Kentucky, obviously we made it work, and it's working beautifully, and it's been supportive for me. Please reach out to her, because she is an amazing, amazing doctor. And just a wealth of knowledge, and you share it. And it's just wonderful. So I bow down to the guru.
Appreciate it. I am on a wait list currently, but once hopefully we'll get that wait list going, and Yeah, if anyone wants to, add their name, they can always just reach out on our website. But it's such a privilege to even have this information in my brain. And I will always respect that. I plan to, hopefully for the rest of my life, respect it and have it. There comes a great responsibility with it. But I know that I'm one of the lucky ones in terms of being able to help people and just teaching people, because a lot of it is there's so much teaching involved and educating people and not holding back on the information and not even having an ego surrounding it, just because essentially we're all just people, and I can definitely, there's been quite a few patients where it's like their stories are so jarring and so you just feel for them, where it's like, I've lost sleep at night just because I want to help these people so badly. And you can see, how difficult and how heart-wrenching their life can be, but yet they're still going, and they're so inspirational in that. And that's where it's not even me, it's more so my patients and their ability to fight and not give up, essentially. And that's where, that's more inspirational than anything else.
Wow. What a beautiful note to end on. Thank you so much for being here and holding space with us today. And again, like Monique said, we will make sure you know where to find and get on that wait list. And I'm like, maybe my name's going to show up on there real quick.
It should.
I'd love
We may as well go keto together, Monique. We do everything else together.
It's true.
Awesome.
Okay,
thank you for having me.
Cheers, friends. You've just finished another episode of the Heart and Soul podcast. We hope that you've enjoyed the show, and if you've loved it, we would love if you'd leave us a 5-star review on whatever platform you're listening. You can find links to leave that review in the show notes, where you'll also find other resources that we reference on our show. And if you think a friend could find value in today's episode or any future episodes, please share this episode with them on social media. This is one of the only ways the podcast can organically grow, and we just can't wait to connect with you and all of your besties. You can also find Monique and I on our many social media platforms or our websites, and we're going to leave links to those in the show notes as well. Thank you for listening. We look forward to sharing our hearts and souls with you again next time. With Heart, I'm Mariah.
And with Soul, I'm Monique.